think any questions? Are there any things you'd like me to cover?
I just recently I was talking to some people that I was on the mid-call, but they now are sending me generic ones to me. And I swear, I have more headaches now than I had before, and I just want to know, they say generics are fine, but I just don't know if there is a real difference between the name and that
By FDA standards, when somebody makes a generic, so if, let's say, drug X, like Lamictal has been made for, they have their patent and the patent expired, then anybody can go to the patent office and get their formula from there, and then start making their own medicine. Now, the people who make generics, often there are more than one manufacturer making a generic. And the drug makers for the generic only have to show that the bioavailability is within a certain percentage. I think it's within about 20%. I may be wrong, but it's a number they can vary. So the drug level may be a little bit lower, and they can still be approved. I think for patients who have easily controlled seizures, generics may be fine. But I think for patients who have hard to control seizures, who are very fragile, who are prone to seizures with slight change in their drug levels, generic, switching to a generic can be a problem. We also know that anytime you go to a certain drugstore, you may get a different generic. So if you use the same generic every time, you'll probably be fine because you could adjust to that generic, you could check a level, you could make sure you have control. And the next time you go to drugstore X, and this time they have a consignment from a different generic manufacturer, and the bioavailability may be a little bit different. So, yeah, it's there's going. I know that there's a law in Michigan State Assembly. I'm not sure it's been passed, but there's a law being considered where it would be. The pharmacist will not be allowed to switch to a generic form unless they inform the patient and the physician. Is it a law already?
No, he's bringing it up.
Espinosa was here this morning.
Yeah.
Yep, there you go.
Is it passed already?
No.
I had pharmacists sometimes send me a form, fax me a form, asking if it is okay to switch to a generic, but that's about maybe 5% of the time.
I got the letter after your medication was sent. And I didn't get it from the doctor, I got it from the place that or we had the insurance.
What you can do as a patient is to look at, because the prescription bottle has, they are required to name the manufacturer there. So you can check the manufacturer, it will be written GEQ or something like that. GEQ means generic equivalent, it will be written in the corner there. If they write GEQ, it means it's a generic.
Granddaughter, when she was first diagnosed 3 days old with the seizure. She was diagnosed with anti-statin until in May. She's 13 months now. But they told me she had a stroke, so her lower ventricles are damaged. She was diagnosed with hydrocephalus, so we had to shunt in, shunt out, not a seizure. Now, with everything I've been listening to, what you were saying, when the doctors told me in May that they told me her life expectancy was not very high. And I got very angry at them because they kind of said maybe 5, 6 years is all she might live. I don't want to believe that because this little girl's a fighter. So are they trying to treat statistic-wise in a situation like that?
Young children who have handicaps, their lifespan can be reduced by certain things. The most proven things which reduce or potentially reduce lifespan are things like if you have a feeding tube, if you're not able to sit by 3 years of age, if you have a tracheostomy, those are some of the things have been studied not in patients with seizures, but patients who have handicaps or cognitive impairment or special needs of any kind. Seizures by themselves in a young child can sometimes reduce life expectancy, but the hydrocephalus itself or the large ventricles, they by themselves do not reduce the lifespan. And the seizures smaller role to play in reducing the lifespan in a younger child compared to the underlying disability. So, if they need a feeding tube, if they're not able to roll over, by a certain age, or there's something which increase the risk of mortality in such patients. And we know many special needs kids who live normal lifespan. Any questions? It's not a very pleasant topic to discuss, but a very important topic. Many of these things are preventable. I think it's important in summary, I think it's important to be aware of these things so that you can potentially prevent them and to follow seizure safety precautions which are easily preventable. Many of the safety precautions I discussed apply to everyone. They don't apply just to people with epilepsy. If you're going to be tired and sleep deprived, you're not going to rush and drive across the highway, It won't make any sense. And if you treat seizures like sleep deprivation or taking one drink too many, then I think you can reduce that likelihood of having an accident. And if you don't go into the water unless there's someone there to supervise or to keep an eye on the person and to make sure that the medication is the person is being treated adequately, taking the medicine as prescribed and monitoring for side effects. And it's important for physicians and for all healthcare providers to screen for any symptoms of anxiety and sadness. It's very important. Any questions? Very welcome. Thank you very much.